Hi, my name is Victoria Rivera, and I'm a wellness psychotherapist in New York City. And welcome to Acute treatment for mental health issues that are coming up because of COVID-19. Today, we're going to be talking about anger. So, anger is actually one of our more complicated emotions, and that's because it serves several different functions. One is as a primary emotion, so it gets triggered based on the internal and external environment. It's an automatic reaction that kind of tells your brain to get into some sort of action. The other way that it functions is that it's a secondary emotion to one of the other primary emotions. So sadness, fear, disgust can be acted out in some way as anger. So anger is almost like the tip of the iceberg in terms of understanding some of the other deeper emotions that you might be experiencing, and especially now. And it's a little bit more tangible in many ways to some of the other emotions than some of the other emotions. So I have a great quote. What makes us angry is disappointment, frustrations, large and small, that we haven't budgeted for, we didn't expect to happen, and we were innocent about. And that's from the School of Life. And I think it's a really great way of kind of understanding anger, and what it means is that it's not something that is budgeted for, and then you have again an automatic reaction, and then you can also have secondary reactions based on some of the other deeper feelings that might be coming up. So you learn about anger through your family. You learn how to communicate it. You even learn in some ways how to experience it, whether you experience it more passively, whether you experience it more aggressively, and how it gets acted out. You also learn that from your parents and your primary caregivers, from your environment, particularly before the age of 7. But that is not, that can shift as well. Anger gets acted out. Again, it can get acted out aggressively via, verbal, being critical of yourself and other people. It can get acted out physically, aggressively. It can get acted out internally, passively, where you will internalize the anger and act it out towards yourself, or passive aggressively, you'll do things that inadvertently are an aggressive act towards somebody else, but not necessarily having conscious intention of that. When our feelings get acted out, and especially if they're really strong anger, we will end up there's something historical about it. So what would end up happening, and this is a really great analogy because everybody kind of uses like almost a volcano. There's already lots of things kind of going on within the lava that's preparing you to kind of blow up. So when you have a very strong reaction of anger, there is a historical piece to that. So being able to understand some of the things that you were upset with and felt powerless and felt vulnerable about in childhood is understandably very helpful in understanding the anger reaction that you have now. So what do you do about this? Well, look, anger, again, is a normal emotion. It's okay to have it, especially now. What I usually teach people is this acronym called U-HALT, and it's based on, substance abuse treatment. It's based on kind of dealing with toddlers and children, so it's asking yourself, when you start to notice the feelings of anger, frustration, are you feeling uncomfortable? Is there anything kind of going on right now that is making you feel uncomfortable? Are you cold? Do you feel pain somewhere? Because that also triggers anger. So are you uncomfortable? Are you hungry? There's a thing called hangry, and a lot of us know that if we're hungry and we haven't eaten, our blood sugar goes down. That can affect our mood, and it can make us hangry. Hunger can make us angry. Obviously, anger is the A and U-HALT, and then L is lonely, especially now. Since we're socially distancing, we might feel less connected to people, and even though we're connecting via virtual visits and all of those things, there's still something that is disconnected and that we do need energetically as humans. And so that could be a reason why you might be angry. And then the last one is that, are you tired? You know, a lot of people are talking about, oh, having time to like sleep and rest, but it's hard to sleep and rest when you feel anxious. It's hard to sleep and rest when you feel angry, when you feel uncertain about things. So really kind of connecting to, are you getting enough sleep? Is it good quality sleep? Do you need to take a nap? Do you need to kind of rest yourself in Shavasana? Do you need to do something that just kind of calms your mind down so that you can deal with the feelings of angry, of feeling angry? That might be related to actually more being tired than anything else. So I hope that's helpful. There's so many things kind of going on. This is just like just a snippet of how to deal with some of the anger that might be happening. And again, I'm going to be talking more about grief and sadness soon. That's also, again, could be the primary emotion, but then anger is what gets expressed. Didn't have enough time to talk about that today, but I will definitely talk about that tomorrow, or probably not tomorrow, within the weekend, I think. All right, take care of yourself and each other, and I hope you're well. Bye.